This is a recording of the WHMIS 2015 webinar. So WorkplaceNL, our vision is of a safe and healthy workplaces within a viable and sustainable system which reduces the impact of workplace injuries by providing the highest level of service to workers and employers. By the end of December 31st, 2016, WorkplaceNL will have improved client service to support the prevention and management of workplace illnesses, injuries, and known occupational diseases. This webinar is a project of the Prevention Services Department. The department has health and safety advisors who provide consulting and mentoring services. Also, occupational health and safety program development and implementation support and auditing services. This is done in liaison with ServiceNL, the Occupational Health and Safety Division. Prevention Services also provides injury trend analysis, training standards and certification, occupational health and safety committee support, industrial hygiene services, advice, consultation, and mentoring, a young worker program to increase the awareness among youth of occupational health and safety, and resource development. The objectives of this webinar are to define WHMIS, GHS, to discuss WHMIS 1988 and WHMIS 2015. It will also discuss the changes to WHMIS that include changes to the classification, labels, and the material safety data sheets. And it will also discuss how employers and workers can prepare for WHMIS 2015. WHMIS stands for Workplace Hazardous Materials Information System. It's a national hazard communication system throughout Canada, and it's made up of two individual pieces of legislation. So we have both federal and provincial legislation that are in play when we talk about WHMIS. So both types of legislation have to be considered. So the federal pieces of the legislation are the Hazardous Product Act, the Controlled Products Regulations, which was repealed and replaced by the Hazardous Product Regulations. Then provincially, we have the Newfoundland and Labrador WHMIS Regulations. So those two pieces of legislation together are in place and that guide the development of WHMIS programs in workplaces throughout the province. The four key components of WHMIS include the hazard classification, the labeling system, the material safety data sheets, which for WHMIS 2015, as we'll see, are known as safety data sheets. So that's why the material is in brackets there, because once WHMIS 2015 has been implemented, the terminology will be safety data sheets. And then we have education and training for workers, which is really the responsibility of the employers and falls under the provincial regulations. So basically the premise behind WHMIS changing is that the incorporation of GHS, or the globally harmonized system, for the classification and labeling of chemicals will be aligned with other countries around the world. So what we know right now is that WHMIS 2015 is here, and as we'll see, WHMIS 2015 is here because the federal piece of the legislation has changed. However, the provincial legislation has not yet changed. So right now we're in a transition period where both systems are really in place, and that causes confusion for workers and employers, understandably. So hopefully through this webinar you'll have a little bit more understanding of the differences between the two different types of systems and how they're currently being used at the same time. So we anticipate that WHMIS provincially will change. The regulations, the WHMIS regulations in Newfoundland and Labrador will change, and it's anticipated that this will be sometime in the near future. So just a bit of background on WHMIS 2015. So in February of 2015, the Hazardous Products Regulations which are produced by Health Canada. They were modified to incorporate the globally harmonized system, which is known as GHS, for workplace chemicals. So the modified WHMIS program is now known as WHMIS 2015. That meant at that time that the control product regulations and the ingredient disclosure list were repealed. And because they were repealed and replaced, federally the legislation has already changed. What that means is right now we have two different WHMIS systems in place. So we have WHMIS 1988 and we have WHMIS 2015. So currently, if you're familiar and you've done WHMIS training in the past, you're familiar with WHMIS 1988, and you may or may not be familiar with WHMIS 2015. So we are in a transition period, and Health Canada has put out a timeline for that transition period. It's going to take place over the course of a couple of years because we know that there is going to be time needed to get everybody following WHMIS 2015. So during that interim where we are right now is both WHMIS 1988 and WHMIS 2015 may be used. What I would recommend is that you allow time to adjust to the system. That will require you to look at current and available resources on a regular basis. So whether it's looking at the WorkplaceNL website, ServiceNL website, and other resources that will be discussed later on in this webinar, it's important that you stay current and up to date with the resources to see what the timelines are and how they're changing. So this is the table that is put forth by Health Canada for the implementation of WHMIS 2015. So right now, phase 1 is from coming into force, so back in February 2015 to May 31st, 2017. Basically, suppliers and employers can comply with WHMIS 1988 or WHMIS 2015 based on the provincial regulations. So because the regulations in Newfoundland and Labrador have not changed, then you would still follow WHMIS 1988. However, if you have WHMIS 2015 products in place, you may have to do updated training there as well, which will be discussed later. Phase 2 is from June the 1st, 2017 to May the 31st, 2018. At that time, manufacturers and importers will comply with WHMIS 2015. Distributors, again, will comply with either or, and employers, again, based on provincial legislation. That will be time dependent there. From June the 1st, 2018 to November 30th, 2018, suppliers will all comply with WHMIS 2015. Again, employers will be based on provincial legislation, and basically by December the 1st, 2018, Health Canada has put forth that suppliers and employers will all be following WHMIS 2015. So that's basically the deadline or the timeline that has been put in place, is that by December 1st, 2018, everyone will be compliant. So just something for you to think about here now. The Globally Harmonized System, or GHS, will replace WHMIS. True or false? So basically, that will be false. The Globally Harmonized System, or GHS, you may or may not have heard of that term already. That's an international program that is used to standardize hazard classification and communication. It's a worldwide system that's being used throughout the world, and it's currently used in Europe, and they're phasing it in the United States currently as well. So because that's an international program, it's not going to replace WHMIS, it's just going to be incorporated into WHMIS. So WHMIS 2015 basically adopted that classification system and has put it into WHMIS 2015. And the benefits of doing that is that it will help facilitate international trade, whereby if you buy a product from Europe, when it comes to Canada, it won't have to be relabeled, there won't have to be a new safety data sheet produced because it's already been classified in accordance with the international standards. So that standard classification will mean consistent information for everybody. It will mean better communication of chemical risks, and it will also be easier for workers and employers to interpret the information. And that's really the basis of WHMIS, is that we want to make sure that the communication of the hazards associated with the chemicals that workers are using are communicated to workers so that they know how to safely work with them. So that's the premise behind the changes to WHMIS 2015, is that it will be easier for workers and employers to interpret the information that they need to protect themselves. So there will be some changes that come into place, which will be discussed. Not everything is changing, however. Some things will be staying the same. So suppliers will still classify their products. They will still prepare their labels and their safety data sheets, and those will accompany the products as you purchase them. Employers will still be responsible for ensuring the proper labels are in place, updated safety data sheets are available. They'll still be providing education and training, and will be implementing the controls necessary to protect the health and safety of workers. Workers as well, their role will not change in that they still participate in education training for WHMIS. They will use the controls that are put in place, and they will also identify any hazards that may arise as they work with those products in their workplace. However, there will be some changes to WHMIS 2015, and there are differences between that and WHMIS 1988. The hazard classification system is changing. The labels will change. There will be new pictograms, signal words, and precautionary statements, and the safety data sheets will also change. The big change there, obviously, is there's no more material safety data sheets. They will now be called safety data sheets, or SDSs. So even that change alone is an adjustment for employers and workers to get used to. So the hazard classification system, it's still going to remain as protective. So if something was previously categorized as a carcinogen, it will now still be, categorized as a carcinogen. It will remain just as protective as it always was. Currently we have 6 classes for WHMIS 1988. However, for WHMIS 2015 we have 31 classes. So there's a lot of new classes that have been added, and they were divided into 2 individual groupings. So we have 19 physical hazard classes, and we have 12 health hazard classes. So some examples of those new classes are combustible dust, pyrophoric liquids, aspiration hazard. So those new classes are there that have been added. So another question for you to think about, true or false, all hazard classes will change. And that answer is false. So not all of them are changing, we're just adding in a lot more hazard classes. Again, they're based on 2 different groupings, physical hazards and health hazards. The physical hazards are based on the physical or chemical properties of that product. So for example, it might be based on the flammability, or it's categorized as, it's put into a physical hazard class of flammability because that is the physical makeup and the chemical property of that product. On the other hand, you could have something being classified as a health hazard, and then it's based on that ability of the product to cause a particular health effect. For example, it may cause cancer. So the physical hazards, I'll just read down through what they are. There are 19 of them, but they're a lot more descriptive, you'll find, than they previously were. So for instance, flammable gases, aerosols, liquids, and solids. So they're all broken down individually, and because of that, it gives the worker a lot more information about the particular substance that they're working with. Gases under pressure, organic peroxides, self-reactive substances and mixtures, pyrophoric gases, liquids, and solids, self-heating substances and mixtures, substances and mixtures which in contact with water emit flammable gases, oxidizing gases, liquids, and solids, corrosive to metals, combustible dusts, simple asphyxiants, and then the last class, if a product doesn't fit really into any of the other classes, the last class that it can fit into would be physical hazards not otherwise classified. Then we have the health hazard classes. So again, there's 12 of these. They're acute toxicity, skin corrosion or irritation, serious eye damage or eye irritation, respiratory or skin sensitization, germ cell mutagenicity, carcinogenicity, reproductive toxicity, specific target organ toxicity. It could be a single exposure or a repeated exposure, aspiration hazard, biohazardous infectious materials, and then again we have health hazards not otherwise classified. So the biohazardous infectious materials class, we currently have that class, and it was kept from WHMIS 1988. It's not actually a classification within GHS. So that one's a little bit different, but it's still there. We have it currently in WHMIS 1988, and it remains in WHMIS 2015. Each hazard class will also have at least one category associated with it. And the purpose of that is that it will indicate the severity of that hazard. So that way a worker can readily identify and get more information just by looking at the hazard category. The categories will be assigned a number or a type. So it could be 1, 2, or 3, or it could be something like A, B, and C. And there could also be subcategories depending on the classification and the complexity of the particular product. Category 1, however, will be the greatest level of hazard. So that makes it easy for workers if they pick up a product and they see something as a category 1, they know that when they work with that product that there's more severity and there's more risk associated with that particular product than if they were working with a category 3. Okay, so again, it's increasing the amount of communication of the risk to the worker. So there are a lot of additions of hazard classes, and that does make it more complex for workers and employers, and there will be a learning curve there for everyone to get used to those new hazard categories and classes. The purpose behind it is that they are more meaningful. The names now really give you more information about the material that you're working with. So if we look at something currently in WHMIS 1988, if something was in a class D2A, which was poisonous and infectious materials, right now they would fall into these very specific GHS classes. So they would now be labeled and would be clearly identifiable as a reproductive toxin, carcinogen, a respiratory or skin sensitizer, a germ cell mutagen, and a specific target organ toxin with repeated exposure. So the names and the hazard classes, while there are a lot more of them, they are more descriptive and they give more information, more useful information to the worker who may be handling them. Next, we'll talk about the label changes. So we've talked about the classification changes and the hazard changes to the classes. Next, we have to look at the labels. The labels will be different on WHMIS 2015 products. The labels in WHMIS 2015 will now contain a signal word, which will be discussed, the hazard statement, pictograms, precautionary statements, and those will all be standardized. The labels still remain the same. They have to contain both English and or French, but everything else will be standardized to make it easier for comprehension. So the signal word is new. It indicates again the severity of the hazard, so much similar to the category in the hazard classes. If a worker picks up a label and has a signal word, that will again give them information more readily and easily. There are a couple of options for signal words. So the signal words could be danger or warning, or it may contain neither of those. So again, danger would be more severe and would indicate a more severe hazard and risk than warning. So if I pick up a product that I'm going to work with and it has danger on it, I know that I need to take precautions when I work with that product. The hazard statements will now be standardized as well. So for example, these are some examples that you may see as a hazard statement on a label. Extremely flammable gas, fatal if swallowed, may cause cancer, causes skin irritation, heating may cause an explosion. And those wordings will always be the same. So it's not going to be questionable about what it means. It will always say may cause cancer. It will not say upon exposure may cause or is likely to cause cancer. So it will just be very standardized wording, so again, it's more easily interpreted. So right now in WHMIS 1988, the symbols that you see are well known. The pictograms that will now be on labels will be a little bit different, and some new pictograms have been added. In some cases, pictograms may not even be needed depending on the classification and again the severity of the hazard. And on the other hand, some products may use more than one pictogram. So right now the ones that we see are in circles, and the new pictograms that we will see with WHMIS 2015 are more similar to those used in transportation of dangerous goods. They're in diamonds as well. So there are 9 of them, and we'll go through what they look like and which hazard classes they represent. Because the flame, for instance, represents more than one hazard class. So it represents flammable, self-reactive, pyrophoric, self-heating, in contact with water emits flammable gases and organic peroxides. The exclamation mark will represent irritation, skin or eye, skin sensitization, acute toxicity, specific target organ toxicity with a single exposure. So this is a little bit different than the health hazard pictogram, because the health hazard pictogram, which is new, that represents a specific target organ toxicity with single or repeated exposure. So the exclamation mark is just single exposure. But the health hazard really represents a lot of the health hazards that may be associated with a product: carcinogenicity, respiratory sensitization, reproductive toxicity, germ cell mutagen, or aspiration hazard. The skull and crossbones represents acute toxicity, which could be fatal or toxic. The exploding bomb represents self-reactive substances and mixtures and organic peroxides. The flame over the circle represents oxidizers. Corrosion represents the corrosive to skin, metals, or eyes. The gas cylinder represents gas under pressure class. And then we have the biohazardous infectious materials. So the biohazardous infectious materials, again, you can see is still in the circle, and that's because it was adopted from WHMIS 1988. GHS doesn't really have a class that we can put biohazardous infectious materials into, so therefore we kept it from 1988 and just adopted it into WHMIS 2015. So that's the only one that will remain in the circle. If we look at a comparison of the labels of WHMIS 1988 and WHMIS 2015, so what do we see? The product ID and the supplier ID, those remain the same. The hazard symbols remain, they're changed, and they're now known as pictograms. They're in diamonds, not circles. The risk phrases are now covered under hazard statements. The precautionary measures are now known as precautionary statements. First aid instructions are now still covered under WHMIS 2015, but they're under precautionary statements. The reference to the material safety data sheet is no longer required on the label, and the hatch border is no longer in play. The only other thing that we have there is that the signal word, again, is going to be added to WHMIS 2015. So danger, warning, or none will be added to a label. If we look at, this is a common example of a WHMIS 1988 label. So we see the product identifier, supplier identifier at the bottom. The risk phrases would be here, our symbols are here in our circles, precautionary measures and our first aid measures, and the reference to the MSDS. This is an example of a WHMIS 2015 label. So you can see that it's quite different. The hatch border, so this hatch border is what we talk about in the WHMIS 1988 label. The WHMIS border, hatch border is gone. The product identifier is still there, and the supplier identifier is at the bottom. The pictograms are there in the diamonds. This danger is our signal word. Number 4 is our hazard statement, so fatal if swallowed, causes skin irritation. These are our precautionary statements. And you can see that the first aid measures are still there. So these are the first aid measures. They're just under the precautions. So you can see that it does look quite different, and therefore you will recognize when you receive WHMIS 2015 products into your workplaces. Again, the labels, some things stay the same. So the labels still have to be in English and or French. They must be easy to read and durable, and if they are lost, damaged, or no longer readable, they must be relabeled and replaced. So that remains the same. So next, let's look at the changes to the safety data sheet. So in WHMIS 2015, the 16-section safety data sheet will be used. And employers and workers will use that information on their safety data sheet to protect themselves from the hazards, and they will also use them for safe handling and use. The new GHS classification is going to be included on the SDS, and the new label text and pictograms are required as well. So, question for you to think about. Yes or no? 16-section format SDSs are already allowed in Canada. And that's yes. You may have already seen 16-section SDSs. That's quite common. And as well, when we looked at the implementation timeline table at the beginning of the webinar, you saw that suppliers, in accordance with the transition table, can comply with either WHMIS 1988 or WHMIS 2015 at this point. The classification label and the SDS must all fully comply with the specific law and legislation chosen. And what that means is you can't comply with a combination of WHMIS 1988 and WHMIS 2015. If your label on your product is WHMIS 1988, you have to have a WHMIS 1988 MSDS. And likewise, you can't have a label from 1988 and a safety data sheet from 2015. So whichever system you're using, the safety data sheet and the label must match that particular system. So you might want to think about, when you finish this webinar, you may want to go back and have a look around your workplaces and verify that you are using the appropriate safety data sheets and labels, whether it's 1988 or 2015, and making sure that you're complying with either one or the other at the same time. So making sure they all match up. So again, not everything will be changing with the safety data sheet. There are some things that will stay the same. Suppliers will still continue to provide the SDSs. The trade secret rules will still apply. They must be readily available to workers, and they must be updated when new information becomes available. Right now, for WHMIS 1988, our current provincial legislation requires an update every 3 years to our material safety data sheets. That will have to be one of the issues and areas that you continue to monitor when the legislation changes in Newfoundland and Labrador. Because federally that changed, and there's no federal requirement anymore for those to be updated every 3 years. However, that doesn't mean that the provincial legislation is going to change. Provincial legislation may still require an update every 3 years, so that will have to be looked at and investigated when the legislation has been changed. So how can employers and workers prepare for WHMIS 2015? We know that there is a transition period, and there have been delays all along. At this point, what we're anticipating is that the changes to WHMIS regulations in Newfoundland and Labrador will change in the near future, but we do not yet have a date for that changeover. So again, we will have to continue to monitor that, and we will communicate it as it becomes available. So what we do know, WHMIS regulations in Newfoundland and Labrador, the employer is responsible for the education and training of workers. So they have to make sure that hazardous products are properly labeled, material safety data sheets are readily available and provide access to workers with those, and provide any updated information as it becomes available. With respect to education and training, because a lot of employers will now be looking for education and training on WHMIS 2015, many private companies are offering training for purchase. Some of them have been known to use very aggressive sales techniques and tactics. What you want to ensure is that you have competent education and training providers. And if that means that you want to do something in-house, then that's certainly appropriate as well for WHMIS 2015 training. WHMIS 2015 does not have to be through an approved provider by WorkplaceNL or ServiceNL. It can certainly be done in-house. You just have to make sure that your provider is competent in WHMIS. So a question that comes up quite often is who must be trained in WHMIS, and all workers who work with or in close proximity to hazardous products have to be trained in WHMIS. Okay, so that's up to individual employers to determine who is going to require that WHMIS training in your workplace. If it's everybody who works with, if everybody in your workplace handles or are in close proximity to the hazardous products, then everybody will be required to be trained. But again, that has to be assessed by the employer. Another question that commonly comes up is, does WHMIS legislation require updated training on a regular basis? And does training expire? And in accordance with the legislation, WHMIS training does not expire. However, some employers will determine that they want their workers to complete training, updated training every 3 or 5 years or whatever, every year sometimes. And that's just a standard that the employer has set. The legislation does not require training on every 3 or 5 years or anything like that. There's no specific time limit given there. It just has, you have to ensure that your workers are competent in their WHMIS education and training. So again, some employers will then say, okay, in order to ensure that, we're going to update the training every year. But there's no specific piece of legislation that requires, that states that there's an expiration to WHMIS training. So employer duties, it is recommended that employers conduct awareness courses with workers on WHMIS 2015 and update or revise their worker training courses to include those new hazard classes. There is going to be a big learning curve for workers, going from 6 classes to 31 classes. The training courses should be updated to include the new labels and the pictograms, the new safety data sheets, and then at the same time you can continue to train on workplace hazards and controls that are in place. It is also recommended that you continue to implement your WHMIS programs, so review your material safety data sheets or any safety data sheets that you're receiving that are WHMIS 2015 compliant. Watch for new products as they arrive and adjust your program as necessary. If you do have new products with WHMIS 2015 labels and SDSs arriving, you will have to communicate, educate, and train your staff on how to read those labels, how to read the new SDSs. Okay, so that will have to be updated as they start to come into your workplaces. Continue to review your chemical inventories. And this is a great opportunity as well for you to look at, you know, are there safer products that we can use in your workplaces to simplify your training requirements. Workers have to be aware that WHMIS is changing and that they will have to learn how to read new symbols, new pictograms, new safety data sheets, new terminology. So they should be made aware of that. But they also have to understand that their WHMIS responsibilities remain the same. They will still participate in education training programs. They will have to protect themselves and their coworkers, and they will still have to participate in identifying and controlling the hazards. So there are a lot of different resources out there for WHMIS. I would encourage you to visit WHMIS.org because that contains a lot of information. I'm going to take you to that website now so that you can look at, and I'll show you how to navigate and see some of the great resources that are there. If you go to the top and click on Resources, you'll be brought to a drop-down menu where you can see a lot of different information. So there's guides, posters, and publications there, many of which are free. So for instance, if you want a pictogram poster, you can click on that. And that's there as a free PDF that you can print off. So again, it has all the different pictograms that you can post up around so that your workers can begin to get familiar with those new pictograms. Again, there's lots of different guides and posters there, fact sheets. So a lot of different resources available. Some of them are by individual provinces. So for instance, New Brunswick has developed a fact sheet on workplace labels. So some of them may be specific to a particular province, but some of them are generic as well. There's also different presentations and webinars there if you're interested in taking one of them maybe and using it at your own workplace. So that might be an option. There's an e-course there as well that you can do much similar to this one, which is an awareness type program. The WHMIS 2015 for Workers course is there. It's $10 for every worker to do that, but you will get a certificate of completion at the end of it. So again, that may be something that you're interested in doing at your workplaces. So again, I would encourage you to visit WHMIS.org. You can also click on the jurisdiction to see where Newfoundland and Labrador is with the status and read through that there. And basically the status as of February 2016, a draft document is being prepared. So again, that will be updated as new information becomes available. Okay, so back to our slideshow. So just to summarize the changes, the hazard classes are now going from 6 to 31 with WHMIS 2015, but they're a lot more descriptive and provide more meaning in their names and will communicate the hazards better to workers. The labels will now have the signal word, danger, warning, or none. They'll have hazard statements. There are 9 pictograms that are different, and those are in the diamonds. And they will also have precautionary statements, which include the first aid measures. The safety data sheets will go from 9 to 16 sections. There's no federal expiry date of 3 years. However, it still may be required provincially. So that will have to be something that will be monitored for the changes. So in conclusion, again, it's greatly recommended that you stay tuned for details on our website about when WHMIS legislation provincially will be changing. However, WHMIS 2015 is here. You will, or you may have already seen new products, but you should keep watch and make sure workers understand that WHMIS is changing and that they may see products come in that are labeled differently and that have different SDSs. The changes are there, but it will remain as protective, and the thought is that, and the hope and the intent of WHMIS 2015 is that it will greatly increase the communication of working with hazardous products. And it's important that that education and training for workers does continue. If you would like more information on WHMIS 2015, please feel free to contact us. Our office in St. John's is there. We also have offices in Grand Falls and Corner Brook. So feel free to contact us and we'll try to answer your questions and concerns as best we can. Thank you and enjoy your day.